Well, it automatically came up. So hopefully nobody has an issue with that. We would like to record it so we can publish it and refer back to it, and it will be posted in various places. So I suppose if you've got a problem, please raise your hand now. So nobody's raised their hand, so we'll crack on. So I'm Neil Shine, CEO of the NBA. We've pulled this together tonight. This will be one of a few, hopefully DEFRA stroke other industry linked webinars that we're going to try and do through the spring to roll out various parts of the new, let's say, funding packages that may or may not be available from DEFRA. So this is really an English only sort of discussion tonight. We've got two speakers. We've got Martin Jenkins, who heads up policy development for various components of the DEFRA's animal health and welfare pathway. Martin's been involved in this since the onset and is also very heavily involved with the Health and Welfare Board for England. And we've also then got Kath Aplin from Boehringer. You know, Kath's a practicing vet, been involved in the industry for a long time, and has had a career that's taken her from Somerset to Cumbria and to New Zealand, but not necessarily in that order. We're going to break some protocols tonight because it only makes sense if Martin goes first on this, and you'll understand that when you hear it, and then Kath will follow. So we'll have two roughly 10-minute presentations, and then we want to challenge these guest speakers with some good questions. I'd prefer if you put your hand up to ask a question so we can do it that way. Worst case scenario, if you're not comfortable doing that, then you could use the chat function. At the end of this, or halfway through it rather, the health and welfare pathway opened this week. Martin will tell you all about that. We'll put a link in the chat shortly so that you can go on that and put your application in process. So without further ado, Martin, I'm going to give you the floor.
Thanks very much, Neil, and thanks for inviting me along. I will just pop some slides up on the screen. Hopefully those are pretty clear for you. So I'll talk to you about the annual health and welfare review, which, as Neil said, opened up on Tuesday this week. And that's sort of, for most farmers, we expect that to be the first step on the animal health and welfare pathway. And I'll talk a little bit more about what those things mean as we go on. So really at the heart of this, it's about trying to have a much better partnership between government, farmers, vets, and really about producing healthier, higher welfare animals across our farms. This is the pathway as a whole. There's clearly a really wide range of reasons to do that around sustainability, productivity, the environment, food security, producing more, our national values. We can reduce greenhouse gas emissions, we can slow the rise of antimicrobial resistance, and we can do that at the same time as delivering better welfare for animals, and also delivering more productive farms. So hopefully a situation where everyone can win. And a really core part of how we've done this has been trying to design it alongside vets and farmers. So farmers and vets have really been driving the design of this policy, talking about what they think will work for them, for farms, for their colleagues on other farms. So it really is farmer-led rather than top-down from people like me. That's been an absolutely core part of how we've worked. So the pathway, there's sort of three pillars to it. We'll mostly be talking about the first one, which is about financially rewarding farmers for better health and welfare, but we're also looking at stimulating market demand and strengthening the regulatory baseline, trying to make that fairer, more proportionate and more effective. But I'm going to focus on the funding side of things. So this is the sort of pathway when it comes to funding. You'll notice the first one is the annual health and welfare review. So that's about getting a vet or a team led by a vet to come out to a farm, look at the health and welfare of animals, do some diagnostic testing. I'll talk about that in a little bit more detail just in a moment. But the idea is that there's different elements to this pathway. So we've also got animal health and welfare grants that are going to start to launch this year. So it might be that some of the things that are identified in your review, the vet will be able to signpost government funding to help you deliver some of those changes on farm. We'll also be launching disease eradication and control programs. So that again builds on what we'll find in the review, builds on the information we'll get from the diagnostic testing. And for in the case of cattle and beef, that's all about BVD. And then we're also looking at payment by results, so sort of result-based funding for making improvements to welfare. This is something that's all designed to be iterative and improve over time. So it's not about a great big bang where suddenly something happens and we think the world's going to change overnight. It's absolutely not about that. It's about having a slow, steady approach that improves and develops as we go. Is something everyone can engage with and doesn't leave anyone behind. So we're really trying to design all elements of this so that any farm could, or any farmer could choose to be involved in this and get something of value out of it, recognizing that different farmers are at a different stage and have a different environment in which to work. So the review itself is supposed to be pretty simple. We've tried as far as possible to make sure it's really flexible, really specific to the farm. It feels bespoke. So in the case of cattle, you just need to have more than 10 beef or dairy cattle in order to apply. Then you'll arrange with your vet to have a review. They'll come out. They should do some sampling and then testing for priority endemic disease. So that would be BVD. Talk about the health and welfare of the animals, biosecurity, medicine use. But really the important thing there is that you and your vet can agree between yourselves where to focus that 2 to 3 hours. So that's all about recognizing that different farms are going to have different priorities, different needs. So rather than us do what I think government can sometimes do, which is give some kind of long checklist that people need to work through, instead what we want to do is we say we're placing the trust between the farmers and vets to decide on what are the priorities for that farm and how do they focus and use their time as effectively as possible. And the intention is really that it's not about sitting around the farm table, looking at forms, looking at paperwork, but it's about getting out on the farm, looking at the animals, talking about the health and welfare. And as part of that, there should be some looking at what actions could be taken to make improvements. Those should be realistic. It's not about a massive list of things the vet thinks the farmer's doing wrong. And there should be a report that goes alongside that, again, referencing the results of the testing, some of those recommended actions. And really important to say, that report isn't shared with DEFRA or the RPA. That report's between the farmer and the vet. That's really important. We want that to be a place where both parties can be as honest and open, as frank as they like, without the fear that this is some kind of backdoor inspection, which is absolutely not what it's intended to be. This is about trying to give more farmers and vets the space to think about health and welfare in a more structured and effective way and really tap into that expertise, rather than about a kind of big brother sort of top-down approach from DEFRA. And then afterwards, obviously, people need to get paid. So we'd expect the vet is probably invoicing the farmer. The farmer logs in to claim the money. Takes about 5 minutes. It really is quite simple. At this stage, all they need to do is provide when the review happened, the name and the RCVS number of the vet, along with a unique reference number for the testing. So we've tried to keep this as simple and easy as possible. And those are all bits of information that farmers should be able to draw from the report that they've had from their vet. And we're aiming to pay as quickly as possible and within 28 days of a claim being made. So moving on, this covers across species, sets out the different testing that we're offering. You might immediately note that there's a different payment rate for beef cattle and dairy cattle. And I hasten to add, this isn't a headage payment, it's a herd payment. So the reason for the difference in payments between beef and dairy is in beef, we're asking for a check test, whereas in dairy, we're looking for bulk milk. So obviously a lot cheaper to do and a lot less impactful on veterinary time. In terms of these payment rates, really important to recognise there should be enough money in there for 2 to 3 hours of vet time. Should also be enough. There should also be enough money for samples to be taken by the vet, the cost of the diagnostic testing, and also some funding left as a contribution towards the farmer's time. Okay. I don't think any of us think anyone's going to be making enormous amounts of money from doing these reviews. That's not what they're about. They're about delivering that high quality veterinary advice and those test results. But it is important to, to reflect that there should be some money there for the farmer as well. And we're not publishing the exact breakdown for that. We don't want to be accidentally setting an hourly rate for English vets or anything like that. So we started doing the testing back in September last year. We had a really big cohort of farmers and vets who volunteered to be part of the testing. Lots of them have been involved. We've learned quite a lot. Been really interesting what we've heard from people. Broadly, people have found it really useful. They felt that the guidance is good. They haven't felt too constrained by the rules that we're putting around it. So they've had the freedom to kind of focus on the areas of most importance to them, which is all really good. What we've done now is obviously we've opened up to more registrations. So at this stage, you'll be able to register using the link that's going to go into the chat. And then sometime later, you'll get an email inviting you to come in and properly apply. Doing that registration should just take a couple of minutes or so. And what we're now doing is working through the people that have registered, starting with people that had already volunteered to be part of the testing. So these are going to continue around the country. We're really excited about it. We've had a lot of positive feedback from farmers and vets that have been involved. We've learned from some of the things that haven't worked as well as they might, and we'll do more learning as we go. I should say again at this stage, it's only one review per farmer, or per SBI, I should say, single business identifier. So if you've got, say, beef and sheep, you'll need to pick one at this stage. And also it's starting with BPS eligible farmers only as well. In time, quickly, we'll open that to non-BPS as well. And again, over time, we'll expand this to make multiple reviews available, which might be that you've got more than one species, or might be that you've got, say, two epidemiologically distinct beef herds in different locations. And again, over time, we'll start collecting a little bit more information, including the diagnostic test results, including a few other bits of information that again, will be co-designed with farmers and vets. I think that brings me to the end, so I will stop my sharing. There we go. And hand back to Neil. Thanks, Neil.
Right. Martin, thank you very much. We'll just move straight. We'll not take questions yet. We'll wait till Kath has spoken. So, Kath, the floor is yours.
Okay, great. Thanks, Neil. And yeah, thanks, Martin. So I was just going to following on from what Martin was saying, just talking a bit about what vets and farmers might practically do and the type of plans they might make in these visits. So I will just share my screen now. So there are apologies, I seem to have a bit of an issue with my screen. Maybe Martin, I can see you. Can you see that? See my screen all right? Yeah, okay. Yeah, just the type of action plan that people might put in place. So I think the first thing to say really is that the annual health and welfare review funding funds some tests for suckler herds. So it funds a young stock check test for suckler herds, an antibody check test, and a bulk milk sample for dairy herds. So that's what the funding is there for. But that doesn't necessarily mean that that's what you're restricted to doing in the plan that you make with your vet. So I think it's really important to use this visit as assistance towards towards creating and carrying out your action plan. But you might need to add in some additional testing that isn't included in the funding. But the funding is a help towards your plan. So I think every farm is going to have a slightly different plan depending on the type of stock that you've got. So, and there's different tests available. There's obviously check testing, there's also tissue tagging available. So it's important for farmer and vet to sit down together and work out what is most appropriate for the farm. But I think any action plan is going to look something like this, which I'm just going to talk through. So you take some tests, whatever tests you and your vet agree are most appropriate. If any of those tests are positive, indicating that there is active BVD in your herd, then it's really important that you have a plan to track down and remove any PIs, any persistently infected cattle in your herd. It may be that you carry out some tests and they all come up negative, indicating that you haven't got active BVD infection in your herd. Fantastic. Either way, at the end of this process, you should end up with a herd with no PI cattle, no active infection in your herd. I think the important thing is at that initial planning stage, it's really important then to have a plan in place for what you do after that, after the testing, and that is to make sure that the herd is protected. It's all very well to test and remove the infection, but then if you're leaving the farm open and susceptible to disease after that, you're just basically kind of waiting for the infection to come in. So really important to have a plan, not just for testing, but also for protecting the herd against future incursion, and then also a plan for future monitoring. What we don't want is a situation where we found, okay, I tested my herd today and it was negative for BVD. I did nothing, and then in 2 years' time, I find that I have now got a BVD outbreak, but didn't see it coming. So yeah, test, remove PIs, have a plan in place to prevent BVD coming back in. Keep monitoring just to check what it is, to check what you're doing is working. And in terms of protecting the herd, a combination, for most herds, a combination of biosecurity and vaccination is going to be probably the way to go. So I think biosecurity is something that we can all be better at, vets and farmers, I think. But it's also important to understand that I think as cattle farms, it's unlikely to be perfect. We're very different to, as a completely contained, say, intensive poultry shed, where you can totally contain what comes in and out of that shed. Cattle farms are much more open. There's people coming and going, potentially neighbouring cattle, and there might even be bought-in cattle. So, and there's shows and potentially staff going to and fro the farm onto other farms, and potentially other animals such as sheep and wild animals. So on the right of the screen there is a sort of summary of some of the risks of BVD coming in, and in reality it's quite hard to eliminate all of those. Important to do your best in terms of BVD control and other disease controls, and have a biosecurity plan in place. But for a lot of herds, vaccination is going to be a part of that herd protection plan. And just earlier this year, NOAA, National Office for Animal Health, produced quite a nice guide to vaccination for the various different farm species, setting out which vaccines ought to be as a default for most herds, and which vaccines might want to be added on a farm-specific basis. And yeah, the default vaccines for cattle included BVD. So that's a suggestion, really, that most farms ought to be vaccinating against BVD as a fairly standard procedure. So I just wanted to, if this works, I'm just going to come out of this screen and show just a little animation showing the impact of removing BVD from a herd and the importance of protecting against it. So I will just hopefully close that. Right, I'm just going to talk through this little animation. So this is a herd with active BVD infection, where the red cattle are indicated as PIs. Has that stopped?
We can
I think
still,
that might not be working. Am I right, Neil?
Kath, yeah, we can just still see your original presentation, 2 slides, not in presentation mode, but
Sorry. Hang on. Right, let me go back into. Sorry about that. I think that's better, is it?
yeah.
Fab. Okay, I'll start again. So this animation shows a herd with active BVD initially. So the red cows are indicated as PI cattle. They're spreading infection. So we've got disease in that herd, active infection. We remove the PIs. What we're left with is a herd with quite a lot of immunity, these green cows, and improving health and profitability in the herd as we've removed the PIs. Following year, calf crop born, negative calf crop because we've removed BVD infection. Great news, we've got a healthy herd. We've also got quite good immunity. But as you go on, that immunity gradually wanes as older cattle leave and naive heifers join the herd. So we start to become an increasingly naive herd. And we run the risk that, say, heifers go off to a neighbouring farm to go to the bull, come into contact with a PI over the fence. Those cattle are highly susceptible to disease. We then end up with PI calves born, infection spreading to a susceptible herd, and a potential BVD outbreak across the herd. So yeah, just showing the importance of making sure that we have a plan in place for protecting that herd as it becomes more naive. So yeah, that's my part done, I think, hopefully. Yeah, happy to hand over to Neil for any questions and comments.
Right, Kath, thanks for that. I love the animation bit at the end. I think that's a great tool, and perhaps DEFRA might borrow that at some point. I think it's a great way of showing things, the dangers of spreading BVD. So I want people to put their hands up and ask questions. So we'll just go as they come. So Charles, please.
That's better. Yeah, that was all. That was all good stuff, and no, everyone must agree it's a good thing to do, and it's a great initiative. I just want to come from my personal perspective. How are we going to stand in terms of funding or anything if we're already an elite high health herd on checks accredited for BVD, IBR, lepto, level 1 for Yonis? What I need to do and sort with my vet is the next one down the road, which we're already testing for, which is Neospora. Are you going to be allowed to be flexible enough to do that? And if we're already on a high level and have got a plan for all these things, because we have to be if you're going to be on checks and retain your elite status, then can we sort of claim it as of right because we've been doing it for the last 15 years anyway?
So Charles, I think what we'd say here is as long as you fulfill the requirements for the review, we're happy. It's really important that people aren't left behind, whether that's people who are just starting out or people who are much further on their journey. So if you're already paying for BVD testing and you're doing that BVD testing, well, great. Government will pay for that now. Good news. You might decide to use that money for a different type of testing or to get a different kind of advice. And that's absolutely what we'd be delighted if that's happening.
And then we have to pretend we spend 3 hours talking about it when actually, if you're already in that status, it's going to take about a minute.
Well, I mean, you shouldn't still need to be having those 2 to 3 hours, but those 2 to 3 hours might be focused on, they can be focused on whatever's the priority on your farm. And if you already every year talk for 2 to 3 hours, having something really similar to the review that's not about an assurance visit or something like that, then great. But I think we know that there's an awful lot of farmers that's not part of their normal, the normal way that they work, or people who can use this funding to go a little bit further, beyond what they're already doing.
Yeah, I get that. Thanks very much.
And I suppose I would just add to what Martin has said that I'd say there's quite a lot of really good high health status herds out there that have eradicated BVD some years ago that maybe haven't talked about BVD with their vet for some time, and potentially things might have changed on their farm where there are some chinks in their biosecurity that might have impacted their susceptibility to BVD. And we certainly see really well run high health status herds that have catastrophic breakdowns with BVD. So I'd say it is a good opportunity to have that conversation with your vet, just run through the protocols that you have in place for biosecurity, buying cattle in, vaccination, and it's a good opportunity just for a review of that sort of thing.
absolutely. Been there, done that. I've seen BVD in a naive herd, and believe you me, that is not pretty. It's absolutely devastating.
Perfect.
Thank you very much. I'll shut up.
Right, Charles, thanks for the question. Ben, you're up next.
Hi, thank you, Martin. I applaud your efforts to sort of raise the lower level of management that's going on farms here in terms of animal health. I'm curious as to whether you did kind of touch on this as far as assurance goes, but is this supplementary or additional to the annual herd health review that we'll be doing already as part of our red tractor for those of us who are red tractored? Because it kind of covers some of the same ground, does it not?
So I think we see these as being complementary. So, importantly, the red tractor review, part of that is about demonstrating compliance to a series of standards, which is not part of what we're doing on the review. What we'd really hope people are doing is in their red tractor or whatever assurance scheme they're in, they might be identifying, often you might be identifying things to go into in more detail or try and resolve over time. The review should be a fantastic way that you can then get funding to do some of those things that you've identified in your red tractor review. So rather than us saying this is the way it must work, what we really want is farmers and vets looking at this and saying, well, hang on a sec, I can use this time and this funding really effectively to delve into these things I've identified through red tractor and make some clear progress on them, rather than writing them down in a plan and maybe not looking at them again for a year. I'm not saying that happens to you, Ben, but I think you probably know some farmers that does happen to.
Thank you, Martin.
Right, Ben, thanks. Can I just ask Martin on the back of Ben's question, and also maybe even what Charles has said, is there absolute autonomy at all levels for people that are already accredited, BVD free, whatever, and with an assurance to use, most, I'll look at it, taking it from a different way, that from a sales point of view, perhaps an opportunity to spend 3 hours with a vet that you don't have to pay for is too good an opportunity to be missed.
I think that's a very good way of putting it, Neil.
Yeah. Okay, right. Ben, is your hand a hereditary hat, a historical one rather? Yeah. So Andrew Lawton, please.
Yeah, I was just wondering, our vet tells us how difficult it is to get vets into the industry. They seem highly stretched. If we get more and more people doing these reviews, is it going to be the vet capacity to do it all?
Yeah, that's something that's come up quite a lot, Andrew. So we've done a couple of things to go into that in more detail. So the first is, as I said, this has all been co-designed with vets and farmers. So there's been a lot of vets involved, a lot of people from the vet societies really closely involved as well. And the view from them in a kind of anecdotal way is, yes, they think there's capacity in the sector, and I'll come into some of the reasoning in just a moment. We've also done a survey of a series of different vet practices about what they'd anticipate to be the impact on them. And again, a high proportion of them felt this was doable and that there would be sufficient resource. There's a couple of reasons for this. The first is, this is work that you can program in and plan for. So it's quite different to the kind of emergency calls that a lot of vet practices have, obviously find it quite difficult to cater to, and which are really critical for farmers. So that really helps them plan out how they're going to use people and when the reviews happen. The other is that actually this kind of proactive health management is the sort of things vets find quite good and engaging and want to do more of. Going out, looking really seriously about how health and welfare can be improved over time. So again, there's quite a bit of interest from vets as well. I can't promise that that's necessarily universal. Nothing's ever completely universal, but that's the feedback we've had both from the sort of vet societies that we've been working with, the individual co-designers, and from some of the surveying we've done across vet practices. Of course, there's likely to be some localized challenges. We can't resolve that, but we were interested to find quite a lot of practices said they'd be willing to travel outside of their normal area to do this kind of work as well.
Right, Martin, thanks. I think that's answered that. I mean, I'm aware there's quite a few vets on this, and maybe one or two would like to put their hands up and be brave and and either come back and agree or disagree with that, just as a matter of course. I've been sent a couple of questions. Kath, this one, I think it's directed at you really. So there's been various BVD eradication programs across various parts of the UK. Can Boehringer as an organisation see a variance in vaccine sales when countries adopt a regulated eradication program? And I think the point here would be, has Scotland got a lower demand for BVD vaccine now that they've been 10, 12 years into an eradication program?
Yeah, I think the pattern probably is that initially at the early stages of an eradication program, vaccine use would go up as people become more aware of the disease, and then that would maintain a quite high level for a while. And then I think in Scotland we are starting to see vaccine use tail off as the risk in some areas becomes lower. So what you're starting to see in some parts of, the infection profile is quite well mapped out in Scotland and Ireland. So some parts of the country the risk is quite low now, whereas other parts of the country, particularly the borders and the southwest, still a higher risk, and there's still quite high levels of vaccination going on. And then obviously in Ireland, in the Republic of Ireland, looking towards getting completely BVD free in the next year or so, probably.
Yeah, great, Kath, thanks for this. The next one, Martin, this comes back to, and I encourage while I'm asking this, I'm sure there's a few other people on here that will put some questions or come up with some questions. You mentioned earlier that in the dairy industry, the testing will cover a bulk tank test. An awful lot of dairy cattle end up on beef farms. That's only going to test the cattle that are in the parlour at the time. Is that bulletproof enough within the dairy industry to stop the spread of BVD?
No, it's not. I think it's probably the quick and honest answer, but with a bit more detail. So at this stage, when we're doing the review, we're trying to get a snapshot. It's not going to fix everything, but we're going to get a lot more information than we've got now. A lot of our knowledge about prevalence is really out of date and from some quite old studies. So it's quite important that we're just getting a better picture than we had. So as we open up into control and eradication programs, so for BVD, for example, we'll need to look at whether bulk milk testing continues to be worthwhile or whether we need to transition over to check testing. And a lot of the co-design is suggesting we need to transition over to check tests for dairy as well, but we'll see how we get on in that space. One of the really important things is that we don't just make decisions. That's all done, with the farmers and the vets and epidemiologists and scientists that we're working with, and so on and so forth. So it's all about improving things over time. And again, I should say really strongly from a lot of that co-design has come through, there will become a time where we need to go beyond financial assistance and towards legislation, and precisely what that might look like and how it might work, so that those that are taking really good effective action have a reduced risk of reinfection from other herds and so on.
Yeah, great. Thanks for that. Andrew, do you want to ask your question in person?
Yeah, I just, it was going on from what you said about cattle originating from the dairy herd and on finishing farms. You mentioned it would be primarily the breeding herds. Will it cover the finishers as well? It's if you've got PIs on a finishing farm, you need to get them out, don't you, I guess?
So in terms of the review, we'd want the BVD testing on all sorts of beef farms, so that we can kind of understand the status everywhere. That's certainly the intention.
Okay, great. In this first part of your presentation, Martin, you talked about result-based funding for improvements in animal health. Can you expand on that a wee bit, or am I jumping too far ahead of the game?
No, that's fine. So that's less my area, to be honest. So it's for welfare rather than health, but it's looking at how can we. So where we've got particular health welfare outcomes that aren't really reflected in the extra price you can get for the market. even though you're producing to a higher standard of welfare. This is about trying to find, can we find a way of recognizing those outcomes, measuring them, and providing some funding to encourage more people to deliver to those high welfare standards. The intention is to do some piloting so that we understand this a little bit better, because it will be quite challenging to do. But I'm afraid that's more my colleagues than me, so I need to avoid going too far down that route in case I tell you completely the wrong thing.
Yeah, okay. So then my next question would be, will there at some point potentially in the future be a legislated government BVD eradication scheme in England?
That's what everyone involved in co-design has been asking for, Neil, and we really respect co-design, and I don't think we've got any examples domestically or internationally where there's been successful endemic disease eradication without having some kind of legislative basis towards the end.
So that's the target, but we just won't have a date maybe in mind yet for that.
So, you know, it's not a government commitment. We've not said that, but, you know, we like using evidence. We like listening to people with a lot of experience, and that's what the evidence and people are saying to us at the moment, but we've not made a public commitment to that. But I don't think we can point to any examples of being successful in eradicating endemic disease without doing it, Neil.
No, that's fair. My questions have kind of run out. Is there anyone got a hand to put up and ask Martin or Kath a question? Or if you don't want to put your hand up, just shout it out. We're at that stage. Anyone need reminding the rugby score at the weekend?
Neil, can I just add, we know not everything's going to go absolutely perfectly right at the start, but we are really genuinely keen to hear back from people, both the kind of good, the bad, and the ugly. So if things are working well, please do feed back to us and say, actually, I did this, it was good. Or if it isn't so good, let us know. We want to improve things over time, and also really importantly, you know, coming and speaking events like this is great, but really what will be good is some of you having reviews, finding that they worked well for you, and talking to your peers about it and saying, actually, do you know what, I did this, it wasn't that hard to apply, it was pretty easy. Actually, I got some free vet time, it was useful, you should think about doing it as well, because that's so much more credible than me coming out and talking to you about it.
And I think, you know, getting a vet on farm paid for to discuss all sorts of health and welfare stuff can only be an advantage. Martin, I've put the link for the application in the chat. Are you quite happy, and Kath as well, to put your email details in the chat? And if anyone wants to ask any specific questions directly to you offline, the facility is there to do it.
Yeah, sure. Yeah.
So we won't say good night until those appear in the chat and give people a chance to copy that.
I've popped that in the chat, Neil, but with the slight caveat that I am on holiday next week. So if I don't respond very quickly, I apologise, but I'll probably be working through a backlog. So, but please do email if there's any burning questions.
Yeah. So I'm going to ask the final question that maybe some people are thinking, but I haven't directly asked it. How quickly can everyone get onto this? Obviously, it's BPS, let's say eligible people or 10 plus animals only. My concern would be that some people that don't or have not had the capacity to claim BPS or have small herds might have equally as much disease.
Yeah, absolutely. So the reason that we're starting with BPS only is purely sort of administrative. It's because we, you know, as DEFRA and the Rural Payments Agency, we know more about people that are BPS eligible. So it just makes it easier for us to get started and get the reviews started. So it's really helpful for the IT and the service. We really recognise disease doesn't really respect whether you're BPS eligible. So opening up to people that aren't BPS, really important. It's one of the first things that we'll do to kind of widen the offer. So I hope that's going to be really soon, but I'm really avoiding being drawn on dates because, you know, as people will know, we've delivered this a little later than we were intending to. You know, I don't want to set expectations and then fail to deliver too badly, but it's absolutely, you know, top of our list of priorities to get to that.
No.
That's really good, isn't it? I think, and those are often those smaller farms are often the ones that aren't potentially engaging with their vet quite as much as some of the farms. So, yeah, as a vet, as a vet, I think it is a really good opportunity for vets and farmers. That for those, probably most of the people on the call are people that engage with their vets a lot anyway, aren't they? But for them, it's a bit of free vet time to go a little bit above and beyond what they're already doing. And I think for the vets on the call, it is a great opportunity for those people who don't engage so much to have a little bit of vet time and just to start to, you know, sort of see the benefit of a little bit of time planning and preventing disease, really.
Yeah, no, Kath, thanks. Right, last call for any questions. No, right. I want to thank everyone for coming. I want to just take a wee plug. Sometime next month, we will have a webinar on SFI/ELM and the new standards that were tweaked week before last. We'll have another expert team on the panel that night to be able to ask a lot of questions. There's a lot of negativity. There's probably, I've been as big a critic of ELM as anyone. I have moved a little bit from what we've seen announced in the last 10 days or so. It's still not, in my view, enough to encourage livestock production, but at least there are some other things there available to replace the existing funding, perhaps. So I'd like to thank Martin and Kath once again, and if we can thank them in the traditional way. I'm not going to ask everyone to unmute and applaud, but I appreciate their efforts tonight.
Thank you.
And thank them. I wish you a good evening, everyone. And once again, thanks for attending, and hopefully you'll come to the next one. Thank you.
Great, thank you.
Thanks, everyone.
Thanks, Neil. Thank you.